Welcome to Heart and Hustle in Hamilton County, a podcast entirely dedicated to the people, policies, and passion that drive local government here in Hamilton County. Each episode is a behind-the-scenes look at the heart and hustle that define the employees and the people that really make your local government work, and all the challenges that they face as they try to bring services to the community that we live in. I'm Jeff Aludo, County Administrator. Bridget Doherty, my coworker, is not with me today. I say that with a little bit of passive aggressiveness, but nonetheless, we're going to move on because we have a fantastic episode for you here today. Today, we're talking about one of the most important phone numbers that you need to know if you live in Hamilton County, and as it relates to protecting some of our community's most vulnerable residents, and that is our children. We're going to be talking today about 241 KIDS, 241 KIDS, the Hamilton County Child Abuse and Neglect Hotline. And I think it's important to say before we get started that I think what you will hear today from the seasoned Hamilton County veterans that we have with us is that every single call that comes into this hotline represents a real child in Hamilton County, represents a real family in Hamilton County that is in need of support. And we are very fortunate here in Hamilton County to have children's services workers that work around the clock to make sure that we are keeping our community's most vulnerable safe. So today we are joined by Aaron Eckert and Mindy Stewart, who are veteran members of the Hamilton County team. We were talking before the show began today just about the extensive history that each of you have. So thanks for being here, first of all, and thanks for the work that you do every single day to keep our children safe. Just to start off, for listeners who may not be aware, talk a little bit about just an overview of the 241 KIDS hotline, how it works, etc.
Sure. We are probably one of the most well-branded phone numbers in Hamilton County, if not our region. Everybody knows who 241 KIDS is. We are the hotline that manages all of the phone calls that come in to the agency with regards to abuse or neglect to children. And in addition to all of that, it's what are the resources that we can manage within Hamilton County, both with children's services and with our community partners. 241 KIDS handles every phone call that relates to child abuse and neglect or a family needing support with regards to their child's behaviors. So our seasoned veteran screeners, Mindy being here with me today, are skilled at taking phone calls, collecting information, and making sure that we're getting involved truly with the correct families in Hamilton County, because we recognize as an agency a government intervention is a very serious and heavy intervention, and we want to make sure that we are involving ourselves with the right families and protecting the children that need protection.
So this phone number, this program, it doesn't just spring out of thin air. Something had to have created this, without going into a history's book worth of lessons on this. Well, how did this come into being? What's the history here?
So our first fun fact is that the SPCA, or Animal Protection, was created before Children's Services was created. And this came out of the need for there being an independent agency or a specialized agency to protect children or to assess the threats that harm children. In 1974, the federal government passed a mandate that across the nation, there needed to be a formalized hotline for mandated referrance to report information to Children's Services for that to be assessed. And that is tied to federal dollars. And that is how 241 KIDS was born. So when you look at things in the grand scheme of things, we've only been around for a little over 50 years, but it's been a strong, mighty 50 years.
Yeah. And what can you say about why this is so important right now?
Right now, just with where families are with rising cost and the needs of their children with mental health, just behaviors that they're seeing. And it's not just the mental health of the children, but sometimes the parents and their own mental health, and being able to care for children who might have behavioral issues or even just special needs. And they're looking for the services and the help, and they get overwhelmed at times. So they're just looking for someone or some sort of support system out there, and they may not know what is out there for them.
Yeah, yeah, and you mentioned the needs. The data that I've seen shows that we have more children coming through into the system now than we have over the past several years. We were talking before the show started just about the confluence of some of the needs of kids, that it used to be maybe one thing or the other that would drive a child coming into care. But talk assuming that the numbers are driven in some way by this confluence of multiple needs. Talk a little bit about what you're seeing in the community in terms of those multiple needs exacerbating the severity of issues with children right now.
So we're seeing a extreme complexity in cases. So before, when I first started at the agency, it was one issue that may be plaguing a family, like substance abuse or domestic violence. Now we're seeing a combination of factors impairing families' ability to care for their children safely. So at this point, it's children with significant behavioral problems, children with profound medical issues. The parents just simply aren't able to cope or manage on their own because they don't have the skills or the support wrapped around them to help them with it. Substance abuse is a huge issue within our community that has contributed to an uprise in children in care.
Financial instability. You have parents who maybe have lost jobs and therefore can't support the needs of their children. Mental health is also, it's becoming more and more brought into light about what's going on with the mental health field, and the diagnoses are more complex. And just being able to maintain your own mental health and also care for children, or maybe your own mental health and children with mental health or behavior needs.
Sure, sure. And you both have mentioned several different types of reasons why someone might call, or you might get a call into the hotline. So how do you go about prioritizing those? I mean, that's a tremendous weight to come. You've got a call taker who's taking this call that evidently comes in because of a child in need, and they've got to prioritize how serious is this, et cetera. So how do you go about straining through that and prioritizing those cases?
Well, I like to say that JFS is like a house, and 241 Kids is our front door. And we are the keepers, the gatekeepers of what comes into our house. And at 241 Kids, that's what we do. We take those calls, we determine and analyze the information that's provided to us, and identify what the significance of the threat to the child or the imminence of the threat to the child might be. So we might have a child who comes in with a black eye to school and discloses that this happened at home by one of his caretakers. We need to see that child right away. We need to see that child that day because their safety is compromised when they return home that evening.
Every situation is different, and so we have to take the time on each call to get as much information as we possibly can. So taking the time to ask just in general questions, and then listening. Our biggest thing is to listen to what people are telling us, and then go back and kind of clarify and talk about, well, what is the concern that you have, and why do you feel that that's such a concern? So we get everything from, there might have been a domestic violence situation earlier in the morning. We get calls about children being left home alone. That's obviously going to be one of our bigger priority calls because we have very young children home alone and no one to care for them. They don't know what to do in an emergency. They don't know what to do if someone knocks on their door. So the most important thing for us as a screener is to just listen and then kind of like piece out what exactly has happened in that environment and what makes them unsafe immediately. And that's how we determine, do we have to respond right away, or do we take it a step further and say, we can kind of hold off on this and maybe see them a little bit later. It's not like we have to see them immediately. So a lot of it just depends on what all is being reported to us.
And from that perspective, what would someone expect, or what should someone expect when they call 241 Kids? Because I'd imagine it's also something that most people, when they think about that number, they think it's like calling 911, right? It takes some level of courage to pick up that phone in some cases and actually call the number. So uh, let's try to strip away some of the mystery for people. What are they gonna hear when they call in?
Absolutely. And you hit the nail on the head. It is like calling the 911 of children's services.
Hmm.
You're going to get a lot of questions. And sometimes that can be a little daunting and off putting. So, just at the very basic level, we need to know the demographics. Are they a resident of Hamilton County? We serve Hamilton County. So they have to be a resident of Hamilton County. Who lives in the home? And that is twofold. We need to know who's there and who's around these children, but we also need to do some background on them for our worker safety and to make sure we know what we're walking into. Because unlike the police who get to walk in with body armor and guns and tasers, we walk in with a clipboard and a pen. So our biggest weapon is our ability to communicate.
Hmm.
And that's what you get on the phone. You get questions, you get people asking you to explain what the threat of harm to the child is, what they see in their own words. And what we always talk about is words are powerful. So I could say to you, there's domestic violence in my home. And that word or phrase, domestic violence, means something to you, but it can mean something totally different to me. So what we're tasked with is asking the next best question. What does that look like? What does that mean? What does it mean to you? What do you actually see? So when you call the hotline, you can expect at least an average of about 20 minutes on the phone for us to gather as much information as possible so we understand what's going on with the family and their functioning.
Sure. And so talk a little bit as well. So you get people that call in, and sometimes you're going to prioritize the cases we've already discussed. How do you go about working with the community on some of these calls?
So I guess my favorite example of this would be is part of what we do is not every call is a report of abuse or neglect. And sometimes we have people who are just frustrated or upset and worried because they don't know what they're going to do next. So earlier when we had the government shutdown, I had a mom call and she was very upset and very frustrated. She couldn't feed her kids. She had applied for her food stamps and applied on time, but then the government shutdown happened. So she was kind of in a gray area, just kind of waiting. She had already been to the food pantry, the food store, and was basically being told you can only come once a month. And so she's like, I can't feed my kids. She said, I went to La Rosa's the night before, and the manager kindly fed my kids. At that time, the county had worked really well with all the community partners and provided us a list with all of the food pantries that were opening up at local churches and different kind of facilities. So in finding out where she lived, I was able to direct her to another food pantry and then several others so that she could be able to feed her children.
That's a really powerful story and really helpful to know. So just at a very high level, the 241 kids hotline is not necessarily something that when someone calls and a case is taken in or a call is taken in is necessarily going to result in a children's services worker going out and the child coming into custody. It very much can at times serve as a resource providing funnel for people who are just in need. And this particular mother called because she needed something for her family, called this number, and you were able to connect her to those resources. That's fantastic.
Yeah, it was a good feeling. It was a good day.
I think that's, as in our profession and in our role, that's one of the things that kind of frustrates us in general is we don't want people to be scared of us. And traditionally, people are afraid of us. If 241 Kids gets called, you're going to take my kids away from me. We don't want to take people's children away from you. We want to make sure that they're safe. We want to make sure the family's safe and healthy and happy. And we can help to provide some of those resources to families. We have a new resource in Hamilton County that we've been afforded with to help with children with mental health issues and getting them the more emergent needs and not have to sit on a waiting list and delay. And we can provide that information when you call the hotline. So those are the times that we really look forward to working with our clientele and our consumers and helping direct them to get into resources.
So in saying that, you kind of talked a little bit about the feedback that you hear on your program. What impact are you when you? I think we. I hope I'm okay saying this. I think you guys said we'll say an average of 26 years of experience that we have between the two of you here. Which is, first of all, again, thank you for everything you've done for the community. When you think about this as your calling, your passion over your career, what impact are you hoping to have left in the community when you finally decide, okay, I'm not. It's time for me to move on to something else.
I think in general, our hope as a social worker is to leave our community in a better place than when we found it in the first place. And that's what we want to do at Children's Services.
Mhm.
We want to leave a family in a better position than they were in prior to us becoming involved with them. And if that means making them self-servant or self-reliant on being able to access services on their own because we gave them that initial first step in putting them in the right direction, that's what we want to do. And that's what we're here for. And that's what drives me in this job.
And I think also in taking calls daily, a lot of times people are frustrated and angry because they feel like we haven't acted quickly enough. But then there's also the other calls where people just say, thank you for listening to me.
Yeah, yeah. I imagine that is very very rewarding in and of itself, because you probably don't 241 kids hotline call takers, 911 call takers. You don't get that very often, right? And any other stories that or things that when you think about stories that you remember, and Mindy, you'd hit earlier on something on a story about a mother trying to feed her kids. Are there any other things that, if you're talking to Hamilton County right now, a particular story that you would just want to say that resonates with you over your time here?
I think we're here. I think what we need to message out is that we're here to help. We get involved with families on sometimes the worst day of their lives. And we are fortunate enough in Hamilton County, unfortunately, due to the COVID pandemic, to have technology that really kind of afforded us the opportunity to collaborate together during an emergent situation where a mother who was in mental health crisis called. And Mindy actually took the phone call so she can explain it a little bit better, and then I can explain what my role is.
So this mother had 2 children, and she was in mental health crisis. She basically was telling me that she was going to kill herself and her children. So this is one of those calls where, with the technology we have, I was able to signal Erin that we had this situation going on. And I was able to keep Mom calm enough. She talked to me. She gave me her address. And in the process of talking with her and keeping her on the phone and keeping her engaged about her children, talking to her about, I got her to tell me about how her kids were, what their ages were, what they like to eat, what they like to play with. And the whole time she's talking to me, Erin was able to listen in on the call, but also contact law enforcement to have them respond immediately, while we also got an assessment worker to also meet them on scene.
Wow. And again, probably doesn't happen every single day, but just shows the work you do. I mean, we know it saves lives long term, but that's one that you had the ability right there, that then and day, that on that day, to save the lives of an entire family, it sounds like.
And that's what we want. We want people to call us.
Yeah.
We want people to understand and know that we're here to help, that we're not here to harm. And in this situation in particular, and this is just one example of many, where we've been able to collaborate on that level to get someone immediately out to a home and get someone immediate needs. That's what we're here for.
Yeah.
And we understand that it's difficult and it's hard to be a parent, and we know the struggles and the issues that people have in raising their children now, and it's our job to be empathetic and caring and still understand what our job and our role is, and that is to make sure that these children are going to be safe at the end of the day.
Yeah, absolutely. That's fantastic. And as you guys are talking about this, I'm just thinking we don't do enough in this community to recognize the work you do. And I say that organizationally and in the community. So this is a lesson learned for me as well as we go through this show. So thank you very much for that. What's next for the program? What's next on the horizon for 241 Kids?
Well, we like to say that there's never a dull moment. Every day is different, and I could honestly say that's probably why I've been around for 26 years, is there is no day is the same. We are really kind of learning more about human trafficking, and that is kind of the direction that we're moving at this point in terms of perfecting some of our resources and tools and knowledge and understanding around what this human trafficking beast is, and how, as an agency, we can work with other departments like the Red Cross and even the FBI to make sure that children are safe and in safe environments. So that is 100% on the horizon.
Sure.
We're also working with the state, and they're actually in end stage testing on a online reporting capability for mandated reporters. So at some point within probably the next couple of years, Ohio will have an online reporting mechanism for mandated reference to report information to the hotline.
Yeah, and Aaron, that's I'm glad you brought that up. Just so for folks in the community who might not know, there are people in the community who are legally required, right, to make a report of abuse, dependency, or neglect when they see it. Right? Can you just talk a little bit about that?
Sure. You wanna? So mandated referents are people like teachers, lawyers, doctors, other social workers, and these individuals are tasked based on their role in their occupation to report any suspected abuse or neglect to a child. And by law, they need to do that, and they're required to do that. So that is who the majority of our calls come from within the organization. But like we've touched on today, we also receive phone calls from family members, other community members, children themselves calling us for help.
I would have to say some of our best referrents are and this is going to sound terrible, but it's like the next door neighbor who lives, right nearby. They don't have a stake in the game, but they hear something that's happening and they call to express a concern.
Sure.
And it may not be the most thorough information, but some of those people have really saved some children because they hear like a domestically violent situation happening and they just call out of concern. So it's not like they're trying to get even with anybody. It's just, I want to let you know this is what I'm hearing, and it's very concerning. And so sometimes those are the best calls. But also, too, the mandated reporters, they call, and they're able to show us, like, it might not just be like this one incident of this child came to school with a black eye, but it's seeing just ongoing situation and something getting worse day by day. So kids coming in and they can't stay awake. Their clothes are filthy. Now their bodies are filthy. They're hungry. They're not getting breakfast. They're having to send home food packets and things for the weekends. And it's just, progressively, they're just seeing more and more concerns. So those are the people that we rely on to make those reports as well.
Got it. And, Mindy, Aaron, thanks so much for sharing these stories. And we always try to keep podcasts, even if they are video podcasts, to a certain time limit, but I don't feel constrained by that in this case because I want to give you guys all the time in the world. Is there anything else that you would like to say in the context of the work that you do, whether it's a story, just something you would like to leave listeners and viewers with, anything else before we break that you would want people to know about the program that you run here in Hamilton County?
I would say trauma is real. What my staff and I see on a daily basis, most people have no idea.
It's very true. The stories that we've heard, and we've told a few, but, for the most part, all day. We are 24 hours a day, 7 days a week, all holidays included.
Yeah.
So we are constantly getting calls. Sometimes they're back to back. Sometimes it's a little quieter.
Sometimes we have children in the office while we're getting these phone calls that we have to care for.
So sometimes it might be a day where it's really busy, and let's just say you've had a call that's bad. You might need to step away for a few minutes and take a break. But at the same time, this is what we do, and we love doing it.
Right, but to your point, I suppose the self-care aspect of this is tremendously important as
Mhm.
well, because what you hear every day, the stories that you hear, the experience that you have with these families, with these kids, has to be trying on a personal level, on some basis as well, right?
Oh, for sure.
Yeah.
For sure.
It is. And I think, along the same trauma lines, we understand and need to recognize the trauma that these families and children are going through as well. And while we may have some advanced tools in managing that because of, what we do for a living or what our degree is in, we need to give that same grace to families and understanding that they may not have those tools. And it is our responsibility ethically to provide them with those tools, and give them the grace that they need to work through some of that trauma and understand and help them put words to what that trauma is.
Well, Aaron, Mindy, thanks so much for everything that you do for not only Hamilton County as a community, but for the kids and the children of this county. Again, as I said, I don't think words can express the appreciation that the organization of Hamilton County and the residents of this county should and do have for all the work you do. So thank you for all of your years of dedication and passion to this work. It's greatly appreciated.
Thank you for having us.
Thank you. And to you, our listeners, our viewers, thanks for joining us on this episode of Heart and Hustle in Hamilton County. This is actually episode 2 of season 6, so we got to really get on stepping up the number of episodes here. To learn more about Hamilton County's 241 Kids Hotline and children's services work in general, I hope you take the time to go to hckids.org. You can learn a little bit more about the work of a children's services worker, the work that Job and Family Services does in this space. I hope you join me in being appreciative of the work that you heard about today with Aaron and Mindy. And as always, don't forget to subscribe on Apple Podcasts, Spotify, other podcast providers for this show. You can also find the podcast on the county administrator's page at hamiltoncounty.ohio.gov. So on behalf of Hamilton County, I'm Jeff Aludo, County Administrator, still horribly uncomfortable with video podcasts, but hope to see you next time on Heart and Hustle in Hamilton County.